Well, hello, everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. And we have one of my dearest friends, Dr. Karen Kaufman, on the show. So before I introduce her, just a quick reminder for those who don't know me, I'm Dr. Arinola Dada. I'm a rheumatologist. I help people with joint pain become pain-free and people with autoimmune disease get their immune system back on track. So today we have my dear friend and brilliant allergist and immunologist, Dr. Karen Kaufman. So Dr. Kaufman is an award-winning allergist. So we are so grateful to have her on our show today. And she received her Bachelor of Science from Penn State and medical degree from Nova Southern University College of Osteopathic Medicine. Dr. Karen Kaufman is a phenomenon. She is one of the most sought after allergists on the East Coast. She is a diplomat of allergy and immunology, an American Board of Internal Medicine, and she's a fellow of the American Academy of Allergy, Asthma, and Immunology. So it is allergy time. So I'm so glad that Dr. Kaufman was able to take some time to talk to us about allergies and seasonal allergies. But Dr. Kaufman, I know that I did not even do your intro justice. So I am going to let you introduce yourself and tell everyone why you do what you do, because I know you are one passionate allergist.
Well, thank you so much for such a kind introduction and for having me here with you and your audience today. My name is Karen Kaufman, and I'm an allergist immunologist in Northern Virginia. My practice is Kaufman Allergy, Asthma, and Immunology in the town of Vienna. And we take care of children and adults and help them with allergies and recurrent infections to feel better and to get their lives back, and to do that with, the fewest amount of medicines that patients need, but really focusing on improving quality of life. And it's such an important thing, especially at this time of year. Here in Virginia, we're all right now covered in yellow dust from the oak tree pollen. And it's just such a tough time for people because their quality of life becomes very impaired. So this is just a great time to talk about allergies and help patients to get back on track.
Perfect. Well, so we're going to jump right into it. So what exactly are seasonal allergies? All I know is that every time patients come in with a little sniffle, the first thing they're saying is, oh, it's my allergies, because I guess nobody wants to be labeled with COVID, right? And so people are more likely to say, hey, when they have a cough and cold or whatever, and the weather is changing, they're like, oh, it's my allergies. Can we tell our viewers exactly what seasonal allergies are?
Yeah, so it's such a funny thing because what you say is exactly true. However, I think what these patients really mean is it's my rhinitis. And rhinitis is a term that we use for inflammation in the nasal cavity. So all of the symptoms that people who have allergies experience, it's a lot of nasal stuff. It's runny nose, it's stuffy nose, it's sneezing, it's itching, it's postnasal drip, cough, ocular tearing, redness, swelling, all of that stuff. That's kind of the bulk of what we describe as allergies. But very interestingly, so allergy is a problem where the immune system becomes hyper responsive to things. In this case, we're talking about in our environment. And so, environmental triggers for an allergic mechanism of rhinitis is probably about 75% of people who describe their symptoms as allergies, where about a quarter of patients actually don't have allergies. They have the same symptoms, but it's a non-allergic mechanism. So truly what allergies are is a hyper-responsiveness of the immune system, where the immune system makes antibodies to things like pollen or dust or dander or mold spores or things like that, in the setting of environmental allergies. And it's those kind of antibodies that drive the onset of symptoms that I had mentioned. So that's kind of what people mean when they say it's my allergies. They really kind of use the term allergies and their symptoms sort of interchangeably.
Gingerly,
But you're
yeah.
right, it's a very unpopular time to have upper respiratory symptoms. We're recently, coming through, the COVID-19 pandemic, and still, everyone doesn't want to share germs and get sick more than ever before, I would say. And so, that it's my allergies is something we hear over here a lot too.
Yeah. So
Yeah.
that's helpful to because I think that people don't, and so so just to piggyback on what you said, so so if the problem is that you're allergic, because in my world, well, if you're allergic to, you have loading an immune response, right, to a particular allergen, that there's something in the environment, does it get worse and worse with each exposure?
It does, and that's often how it even starts. So, in my field, we take care of children and adults, and even in young children, sometimes we see, parents who have infants who say, I think my kid has allergies. Can we bring them in for testing? And even in the development of allergy, you need to live through a pollen season to become sensitized to subsequently become reactive. So that reactivity will change over time, depending on exposures, environment, travel, people who move, all of those different things play a role in the progression of allergy over
Yeah.
time.
Yeah.
But yeah, the symptoms of allergy, as we get older, they kind of compound on one another. And so it's very interesting because sometimes I meet patients who just have tremendous allergies that are present all throughout the year. And they're so used to adapting to it. They're like, oh, that's my baseline. It's
Yeah,
like,
that's so
imagine
true.
what your baseline could truly be without all of that reactivity. So yeah, it's very, very much so.
So what can we do kind of now that we know that it's allergic to, certain, allergens in the environment? What are the steps that one can take to proactively kind of prepare for kind of allergy season or, seasonal change?
Sure. So, what we like our patients to start with always is going to be environmental control measures because, again, the more stuff that we can do to mitigate our symptoms without even going in the realm of taking medicines, which we'll talk about medicines in a little bit, but, as much stuff as we can do that involves limiting our exposure is helpful. Now, so what do you avoid? Well, it depends, right? So it depends what your triggers are and it depends what your allergens are. So having allergy testing to kind of delineate what is the source of my symptoms is very helpful. Although, when we talk about individuals who have non-allergic rhinitis, things like exposure to pollen can still be a trigger. It can be an irritant mechanism. So,
Yeah,
you know,
yeah,
pollen, which is what we're dealing with here right now,
yeah,
in Virginia, we're in our tree pollen season, very
yeah,
difficult to avoid completely because we certainly don't want to tell people you can't go outside, right? We want to enjoy our lives and do all the things that we do. So really our first environmental controls start with getting what happens when we get home or when we come inside. So things like simple things, taking your shoes off at the door, washing your hands and face when you come indoors, even using a little saline and washing out the inside of the nose. Very,
Okay,
very helpful.
okay,
Taking
okay,
a shower, changing your clothing,
okay.
washing your pets more often, things like that. Those are things that help. Ensuring that air filters are in good shape, both at
Yeah,
home, filters in the car.
yeah,
Those environmental controls help. For some people, it may not be pollen that's what's driving their symptoms. So indoor allergens like pets and dust mites and things like that, they all have their own modalities of how to control environment as well, using air cleaners within the household, washing your linens every week with hot water, encasement covers for the pillow and mattress, keeping the humidity in check. All of those things are simple things that are easy to do, but people can do and implement at home and actually, do a lot of good to reduce some of their symptom triggers. Even for folks with non-allergic rhinitis, we do environmental controls for that too, because things like candles and plugins and room spray and cleaning products, all of these particulates that we aerosolize, all are major triggers for symptoms of rhinitis. So yeah, so I would say in good preparation, kind of recognizing I feel bad around this time of year because, and then like what are the things I can simply do. Those are things that even, my own kids in our house, these are the things that we start with. Everybody take your shoes off, go wash your hands and face, and then of course, trying not to touch your nose and touch your eyes and all of that stuff, which
yeah.
certainly doesn't help.
Yeah. But yeah, and that's so helpful actually. Also understanding, I hadn't even thought about just using the saline irrigation
Yeah,
to actually physically kind of like remove kind of the pollen and the irritants. So whatever irritants they are, that's so helpful. And yeah, totally makes sense. But sometimes you actually have to hear it to okay,
sure.
yeah, that makes sense to do. So definitely, so I think that's empowering, right? There are some things that we can do. Otherwise people just say I'm allergic to pollen. Oh, you know what to do, right?
Right.
It's everywhere. But you know, when you're coming indoors, when you're in your vehicle, those are things that you have control over. So kind of taking care of things that you have control over. And you have to
Right.
sleep. So you spend a long time indoors, right? So hopefully
Absolutely.
that's more than 8 hours, right?
Right.
That you're
Exactly.
indoors. So
Exactly.
totally makes
Exactly.
sense.
Yeah. And then,
Okay.
yeah, go for it.
No, go ahead.
I was going to say, beyond that, most of the medications that people might use for allergy are things that you can go to your neighborhood drugstore and pick up. A lot of the things that we start with are available over the counter. So, being knowledgeable about what the different medications are, what they do, what to choose, how to start, all of that is very, very important because otherwise, I mean, you can go down 2 aisles filled with stuff that says like sinus and allergy or something like that and have no idea what you're choosing and why. And again, in the realm of let's use the least amount of medication that we require, it's really helpful to be knowledgeable about like what are those choices, what do they look like, and I kind of think about some of those options as sort of like, I call it the starter pack, because by the time people make it into my office to see an allergist, immunologist, and usually people are on a bunch of stuff already. So, we want to make sure that patients are knowledgeable and that they choose things that are going to actually be appropriate for the symptoms that they're experiencing.
You know, that is so true. And I mean, I see people where they probably take a little bit of this and a little bit of that because they're not really
Right.
sure. So you're underdosed, right? And they're like, I
Right.
tried this, try this, try this, try that, but then they underdosed, and so they're not getting the benefits, and because they're not really clear on which specific type of medication they should use, they're just like, I'm going
Sure.
to get 5 bags of this. So makes so much sense to have a good understanding about the treatments, right? Any hints,
Sure.
any further hints on that though?
Well,
That's
yeah, I
helpful.
would. I do. I would say one thing that I hear all the time, patients usually will start with antihistamines, which are going to be, various, usually tablets in children, liquid. But all of these allergy tablets, patients take them and then they come in and they say, well, they don't work. I'm so congested. Well, they don't work for congestion. They're not going to help with that. So to know, what to expect, what's a reasonable expectation. So your antihistamines, which generally, patients usually will start with the second generation antihistamines. These are medicines like, loratadine or fexofenadine, cetirizine, levocetirizine. These are our longer acting, less sedating antihistamines. They're going to really help for things like what I like to call the wet symptoms. So like the runny, the drippy, the sneezy, the itchy, all of the tearing, right?
Yeah.
Anything that's like wet and coming out of your face, that's antihistamines. Whereas, for people who experience a lot of congestion and postnasal drip, starting with an anti-inflammatory, so we use nasal corticosteroids in this case, tend to be our first line. But other things that you can find over the counter are things called decongestants, which they sound like a great idea, right? Like I'm congested, I want a decongestant. But even like nasal decongestant sprays, they actually can make your symptoms much worse. And
Ouch.
so, yeah, so it's really tough because, it's not that clear when you go to the store, like what is actually going to help me and what is not. So it's really, really tough. So we try to do a lot of educating and things like that because, we want people to start with the right thing versus, things that aren't going to be very
Yeah.
helpful for them.
Yeah. That is so true. I was going to ask about rebound, right?
Yeah.
When
Yeah, the
you
nasal decongestants for sure
distance.
will cause
Yeah.
rebound. Yeah, so this is
Yeah.
like oxymetazoline is a great example. And these nasal decongestants, which come under many brand names, you
Yeah.
use them and they're vasoconstrictors. So they constrict all
Yeah.
the blood vessels in the nasal cavity. But then as soon as everything like comes back, it's
Yeah.
worse than
Worse
it
than you
was
started.
before when you started. Yeah, so really, really tough. You can use them probably for a couple of days. And then after that, you're going to get in trouble. Yeah.
Yeah. Yeah.
No
Wow.
question.
Okay. It's funny. You think it's a little thing, but there's so much to the science behind it and towards, which you use for what and what dose you use for, and understanding that rebound can happen based on, if you're overusing it, you're like, oh, this works great, I'm going to use more and more and more, and then you end up with that situation. So, Dr. Kaufman, I personally know patients that have seen you that have had amazing outcomes. But can you tell us about like a story of a patient that has seen you and has had kind of really good outcomes you'd like to share?
Sure. So, I will say when we see patients in the office, we like to help to delineate what's the problem, right? So, anyone who comes in with rhinitis, it's always a good idea to do testing. So, to really figure out, where do we start? Like, what are the things that we're going to target? So, we always start there. And once we have a good understanding, we get patients started with environmental controls. And of course, we utilize medications to mitigate symptoms. The real benefit that we can offer is, that patients can start allergen immunotherapy, which is a treatment that really targets the immune system. So it kind of gets to the bottom of it, right? It changes the way that the immune system recognizes allergens so that over time, not only will symptoms be less, but that need for medications is less and quality of life gets better. So, it really is, I can tell you story after story of patients who come in, whose lives are completely disrupted with their symptoms. And, I've got patients who can't go to work and can't go to school because their eyes are so swollen, they're tearing, they're so congested, they can't breathe at nighttime, they are completely miserable, they're fatigued during the day because, they're completely disrupted. And then, of course, trying all these different medications, which some of them are sedating, and then they just feel worse. And, totally they feel like they're underwater, they can't breathe through their nose. In fact, I had a woman in my office last week who literally was in tears because her pollen allergy is so severe and the things that she was using on her own were just not giving her any relief. And she couldn't go to work, she couldn't sit through a meeting, she couldn't speak because her nose was so congested and she had to completely breathe through her mouth. So we see things like this all the time. And so to be able to offer a treatment that over time is going to take that away is completely life-changing for patients. That I say this all the time. One of my favorite follow-up visits is to do when patients have been sort of at their treatment dose for about 2 years. That's such a sweet spot. So patients come in and you'll say, well, how are your symptoms going? Like what's happening with your allergy control? And they'll say, oh, well, Dr. Kaufman, my symptoms are truly gone. And I keep antihistamines or medicines as needed, but I really don't need to take them anymore. And my life is completely different now than it
That's
was
something.
before
Isn't
I
that
met you.
something?
And there's just so much value to that because this can happen to people and in all ages and stages of life.
Yeah,
And so, we have a long life to live, and to live it in a way that makes us feel so impaired and so miserable
yeah,
is not worth it. I say all the time, it's not your choice if you have allergies, right? If you
yeah,
have allergies, you can say, thank you, mom and dad, and I live here, and whatever it is, like, it's not your
yeah,
fault. If you get it, you got it. But it is your choice as to what to do about it. And there
yeah,
are options and there are ways to fix
yeah,
things. And certainly
yeah,
there's a lot of other things that we do as well. But
yeah.
it's just it's a wonderful gift to be able to offer to patients who truly suffer with
Yeah.
something that is so impairing of their quality of
Yeah.
life.
Yeah, I totally agree. And I think in my world of rheumatology, it's actually very similar. So one
Yeah.
thing you kind of mentioned was immunotherapy. And so, I think about the advances in medicine, like in the last decade, it's been like phenomenal, right?
Yeah.
And I'm sure just the same in the world of allergy, right? Because I know some of the medications you use kind of overlap with some of what we use. And it's just been kind of just astronomical discoveries. So I just wanted to kind of get a sense from you if you had any thoughts about, patients participating in clinical trials and how, and if it helps us.
Oh, yeah. I mean, there's just so much value to being a part of an opportunity to gain more knowledge and even new indications for medicine. So we see this all the time, and I'm sure this overlaps a lot with your patient population because we use a lot of biologic and immune targeted medicines for various conditions. In my field, a lot are driven toward asthma and atopic dermatitis and nasal polyps and problems of eosinophils in the esophagus. And now we even have wonderful, wonderful data of the use of biologics in food allergy, which really is groundbreaking. So, I'll just to comment, earlier this spring, we had just this amazing kind of landmark study that's being done with a medicine that's been on the market now for over 20 years for other indications. And these brave people who decided that they wanted to be a part of clinical research now have allowed for this great medication to be used in patients with food allergy, even approved down to the age of 12 months, which is just
Wow,
wonderful, but
that's
also approved.
amazing.
It is. And it's also approved well into adulthood, which is so nice for these people who, when you think about, being a parent of a child with food allergy and getting them through childhood and junior high and high school and all this stuff, and then they're going to go off to live in the world. Maybe they'll go away to college. And so to have a treatment modality that can transition with kids, from childhood into adulthood, it's
That's
approved for
something.
adults. I'm so grateful for the patients that have participated in these clinical trials because they've really opened the doors for patients everywhere with new data and new information. So there is just so much value to participate in clinical trials and to really be able to, advance medicine and what we're doing and being able to really improve the quality of life in a way we completely could not before.
I
So
totally
it's wonderful.
agree. Yeah,
Yeah.
I totally agree, Dr. Kaufman. And yeah, and we run clinical trials at our clinic in the greater Seattle area, and just excited about the patients and their participation. And we're just moving forward and finding cures, right? So I know that's happening in the world of allergy, it's happening in the world of rheumatology. And so on that note, Dr. Kaufman, how can people find you? Because you're an amazing allergist, and this is allergy season. They should be they're already knocking. I know you have a VIP wait list of people, but how can people find you? Because I think they really need your care. So, because otherwise, like you said, there are 2 aisles of decongestants to walk through. How can we do better? How do we find you?
Yes, thank you. So my office is in the Northern Virginia area in Vienna, Virginia. So we're in a suburb of Washington, D.C. And to find out more about my practice, you can find us on our website, which is kaufmanallergy.com. And of course, you can follow us on social media as well, where I am present on Instagram and Facebook. So I'm on Instagram at dr.kaufmanallergy and on Facebook at Kaufman Allergy. And so it's actually, I'm easily found in either place, but I'm just happy to be able to be one of the helpers, right? So I think a lot of us who go into medicine, we do it because we want to be able to care for people in our community. And, that's really what we do in our practice is we just really embrace those who need us and to really be able to guide them through how to, how to live better. And it's just such a wonderful thing to be able to offer to patients. So we are happy to do that here in our practice. Yeah.
Well, wonderful. Well, thank you everybody for listening. So if you're in the greater Seattle area, find us at overlakearthritis.com, Dr. Dada. I am going to put Dr. Karen Kaufman's information in the show notes. And so we'll have her link, information about her website and everything, so you can find this amazing allergist, Dr. Kaufman. Thank you so very much, Dr. Kaufman, for coming to the show today. I appreciate you taking a Saturday to talk to our patients. We will talk soon. Thank you.
Thank you for having me.